Assalamu alaikum, Bismillah Rahman Rahim. Don't change the position of the patient too much. For example, if the patient is lying down, do whatever examination of the systems of the patient you can do in the lying position. And don't make him sit until you complete the examination of all the systems in the lying position. Then make him sit and examine from the back. For example, the respiratory system. I will tell you my experience. I examined the patient in the lying position and had not completed my examination in the lying position of the patient and made him sit and examined the respiratory system of the patient from the back and then made the patient lie down again and started examining the patient in the lying position. The examiner told me that you are making him sit and lie down position many times, which is painful for the patient. So do not tease the patient. It puts a bad impression on the examiner. For example, if the gastrointestinal system is your main system, then start the patient examination. If the patient is in the lying position, start examination from the foot end and then go for the general physical examination. Start with the nails and the fingers and then the palms and then the pulse, blood pressure. I will not complete all the steps of GP because it is not a main topic. After that, the axillary lymph nodes, which can be checked in the lying position as well as in the sitting position. After checking that, you can check the GVP, and after that the thyroid examination can be done. If thyroid is not swollen, then you can ask the patient to do the practice of swallowing, and you can complete the steps of thyroid when the patient is sitting in the sitting position. But here, just to show to the exam that I have checked the thyroid, you would examine the sclera, conjunctiva and the oral cavity and complete the general physical examination by checking the pedal edema. Then move to the main system, as gastrointestinal system is your main system. So do all the steps completely and with a good technique: inspection, palpation, percussion or auscultation. After you have done this, then move to the cardiovascular system. Cardiovascular system is not your main, so check, palpate the apex beat and locate the apex beat, peristernal heave and auscultate for the murmurs. Don't go into the detail or changing the position or for the murmur, that is not needed. And after that, proceed for the respiratory system and check the trachea and do inspection, palpation, percussion, auscultation quickly. Don't have to move and go into the detail. After that, check for the lower limbs and neurological system. Just check the power, tone, reflexes, planters and quickly check the sensations. Don't check it in the upper limbs because it is not needed, and do it quickly. You can complete the neurological examination by completing the cranial nerves in the lying position, as it is not your main system, so you can do the cranial nerves in the lying position. Otherwise, if you are keen, do it in the sitting position, but do it quickly. After that, the patient, you make him sit. So in the sitting position, do all the steps which are necessary in the sitting position. You can check the respiratory system from the back, and you can palpate for the cervical lymph nodes if you have not done earlier, and you can palpate the thyroid, and you can do the cranial nerves if you have not done in the lying position. So do it quickly. It is not your main system. One very important point is, if when you go to the patient and the patient is already sitting, don't make him lie down. You can do the foot end examination and start with the general physical examination of the head, and you can complete a GPE and a thyroid and examination, and then make the patient lay down and do the abdominal system and other system. So it will save your time, and the patient will not be teased very much. In the cardiovascular system, if the cardiovascular system is your main long case, the same steps as of that of gastrointestinal examination, the same steps can be applied. And now we should move to the respiratory system. In the respiratory system, if the patient is in the lying position, so there is just one point to be noted, that again start from the foot end examination and GPE, general physical examination, then move towards the respiratory system and do all the complete steps by checking the trachea, tracheal tug and inspection, palpation, percussion, auscultation, all the steps with the proper method. But you don't have to make him sit now for examination of the back of the patient, because it will put a very bad impression. So you can quickly check for the heart for completing the inspection and auscultation and the apex beat and peristernal heave, and you can examine the abdomen for the liver and spleen, and don't have to go into the detail. If there is a ascites, you can do the fluid thrill as well. Then quickly do the examination of the lower limbs, neurological examination, again power, tone, reflexes, planters and just sensations only in the lower limb, and and you can check the cranial nerves here, but you can check when the patient is in sitting position. So after completing all the steps in the lying position, then make the patient sit. Here now you have made the patient sit, then you go to the back of the patient and you complete all the steps of the respiratory system. And if you have not completed the cervical nodes, you can do here thyroid examination. And again, if you have a keen, you can do the cranial nerves, but very quickly in the sitting position. If the neurological system is your main long case, then start examination from the foot end and do the GPE, and then proceed to the lower limb examination. Do all the steps completely here: power, tone, reflexes, coordination, and the planters and the sensations in the lower limbs, and then proceed to the upper limbs, proceed and do all the steps in the upper limbs. And if the patient is not in the sitting position, you don't have to move to the cranial nerves now, because you have to do the abdominal examination. So abdominal examination, do it quickly, and do the respiratory system quickly examination, and the cardiovascular, just you can auscultate or you can palpate and auscultate quickly, and then make the patient sit. And after making him sit, then you can do the cranial nerves here and examine the spine of the patient. It is very important to examine the spine in neurological case, and if you have not examined, then you are failed. So after that you can proceed for the gait. So this is the scheme for the neurological examination. In the rheumatological examination, if the patient is lying down, you can do the GPE, but you have to make him sit for that for the rheumatoid hand examination. So you can do the GPE even here in the sitting position if he is already sitting, but you have to make him sit for the rheumatological hand examination, and put the pillow under the hands of this patient and do the rheumatoid hand examination, and the elbow examination. Quickly check the shoulder joint. As the patient is in the sitting position now here in the rheumatological, so you can also after doing the GPE here, GPE, so you can also check for the respiratory system quickly by the back. Then make the patient lie down and examine the ankle of the patient, knee joint of the patient, hip joint of the patient, and you can also check the movements of the spine. Now as the patient is in the lying position, you can quickly do the examination of the abdomen. You don't have to complete all the steps, and then you proceed for the cardiovascular. You have to check the heart just quickly, and also check the respiratory system. Don't have to go into the detail. So after that you can check for that for cranial nerves in the lying position. These are not necessary, but you can check it in the lying position, as it is not your main system. Then the patient can be make in the standing position for the walk and for the goer maneuver and for the tandem gait. You can also check the spinal movements in the standing position, and you can also lateral spine movements in the standing position, and occiput to wall distance and Schober test in the standing position. So we have learned here that we have to keep the position of the patient in mind, and it is very important. It saves your time as well, and there is less pain for the patient. So always do whatever you can do in one position and then move to the other position. Thank you.